Good morning, my subscribers. Good morning, everyone who is looking information regarding veterinary and pharmacy. So I am here with my channel. I am certified veterinarian pharmacist with 25 years experience in retail pharmacy. Today I'm going to be explaining you canine cardiovascular disease. Common cardiovascular disease in dogs. It's chronic mitral valve disease, also known as canine chronic valvular heart disease. It affects about 85% of dogs, and especially in older age. And 75% of canine heart disease, that's what it is. It's a canine chronic valvular heart disease. It's commonly affects mitral valve in dogs and cause them to be to have several symptoms as disease manifests itself in the older ages. So usually more like decreasing in activities, gaining weight, edema, cough, which is similar symptoms in congestive heart failure in humans. So there is several treatments obviously available in the market. Some of it similar to humans medication, some of it particular, very specific for veterinary medicine. This disease mostly affects small breeds, males in small breeds, like Shih Tzu, Yorkshire Terriers, Pomeranians, also miniature Schnauzers, even Maltese, Fox Terrier, so the smaller breeds. But they develop this disease in older age after 13 years old. That usually manifests itself. So several of them, several medications, like I mentioned, they common for humans, like furosemide or Lasix. That's a common diuretic that helps to remove liquid from body. Especially it's helpful for pulmonary or congestive heart disease stage 3 or 4, where you have a lot of liquids collecting in the lungs and dogs start coughing or breathing, and you can feel that phlegm kind of mucus building in their lungs. It's pretty safe medication, but obviously it's a severe diuretic, very strong diuretic, so make him go bathroom a lot. So give him in the morning one dose. It's 2 milligrams per kilogram, and some veterinarian prescribe it twice per day. So give him one little dose in the morning and watch for frequent urination, especially first 2 hours. With food or without doesn't really matter. Probably with food would be easy. In addition to that, common medication, it's specific for dogs. It's Bootoff. It is medication similar to beta blockers. So the medication regulate the heartbeat and slow down heartbeat, and also helps keep it regular. Common side effects, it's a very slow heart rate and lethargy, kind of like apathy to any activities, sleepiness. So that's common side effects of this medication, but usually in the small doses it's very well tolerated and it goes away possibly in a week or so. If it persists, contact your veterinarian. Common side effects, common medication also prescribed for human, it is enalapril. It's an ACE inhibitor that helps to protect the heart, regulate heart, and also helps with the blood pressure in humans in particular. So enalapril usually prescribed once a day for humans, but twice a day in dogs. Common side effects, it's persistent, hacking, dry cough. If you notice something like that, contact your veterinarian. They might replace with another medication. Given with food or without doesn't really matter, whatever is convenient and easy for you. Make sure that all medications that you give it to dog doesn't cause any distress for pet. Kind of gentle, introduce it to the medication and find a way to give it to them with a little bit of food because it's easier. Some Some breeds allow just to stick in the mouth. It's no big deal. You can do that too. Let them drink a little water and they should be fine. Two more common medications for this particular disorder or disease. It's a digoxin. It's a human medication approved also as off-label for dogs. Very small doses. This digoxin or lanoxin, they call it also Dig. It's just kind of a common name. So make sure you give it with a little bit of food and watch for the side effects. Like anorexia, might affect the eyes, diarrhea, vomiting, stomach upset. So it's approximately also given twice a day with a little bit food. Diltiazem, it's another common medication, calcium channel blocker. Calcium channel blocker helps to slow down the heart rate, normalize the heart rate, also straighten the heart, and remove also slow down the heart, low blood pressure. Very common side effects. It is a constipation for human and for vet patients as well. So watch for the constipation and give them a little bit more fiber in their food. Choose some pet food with enough fiber in it. A certain medication prescribed for pulmonary hypertension, like sildenafil. It's a common name and brand name Viagra. Actually, have been given to human and veterinarian practice with very little dose, like 1-2 milligram per kilogram, every 3 or twice a day. So that medication pretty safe for dogs. In the beginning, for only one indication for this medication, it's pulmonary hypertension. Don't give them for anything else. But your doctor knows what to give, so just follow directions. Spironolactone also been known to help with a heart condition. It's off-label. It's prescribed for human, but off-label for dogs. And adverse effect is vomiting, nausea, diarrhea. So watch for that for sure. Can cause hyperkalemia, which is high potassium in the blood serum. I'm sure your doctor will monitor this amount of potassium in the dog blood. Also, I want to mention one more medication. It's called Bootoff tartrate. That's similar to, it is like a beta blocker, but prescribed particular for dogs. Tarbutrol. Tarbutrol, that's a brand name. Particular for dogs. So, especially who has cough, dogs who has extreme cough due to congestive heart failure, so that helps with that. And it causes a little bit sedation, lethargy, like a lot of common beta blockers. So that's a small review for common medication for cardiovascular disease in dogs. If you have more questions and want to discuss this medication in details, like pet regimen, lifestyle, contraindication with other medications, side effects, or other questions, so please contact me on this page or on my website that I mentioned in my channel page. Just mentioned list of medication, and we can discuss that face to face. Dog who treated with enalapril have to recheck with a veterinarian about 3 to 7 days after therapy is initiated. Make sure it doesn't affect the kidney function, because that medication can affect the kidney. Medication should be given, like I mentioned, in food, or a lot of them prescribed in a suspension form, which is much easier to give in liquid form. Or sometimes pet owners like to purchase like a little gelatin capsules and put medication inside and stick in dog mouth because it's kind of goes down a little easier than just tablet. So if we in my pharmacy, we can compound certain medication also for veterinarian patients. So if you have, like I said, any question, I can demonstrate how to give the dog medication safely and less stress. I guess it's all for today, and I will see you tomorrow with more videos about common disorders and diseases in animals, pets, and cats. So just like my channel, subscribe to my channel. I'll be here almost every day with you talking about different